Conversations on Race is brought to you by Froedtert and the Medical College of Wisconsin, U.S. Bank, AARP Wisconsin, and the Milwaukee County Office of Equity. Welcome to Connect MKE Conversations on Race. Our ongoing series explores Milwaukee community issues through a racial lens and introduces us to people working for equity and to make our community better. I'm your host, Denise Calloway. In this episode, we cover a variety of topics, including how U.S. Bank is addressing the unique challenges of small businesses and helping them reach their full potential. We'll hear about a program that helps connect students to their heritage, history, and culture through music. And we visit Milwaukee County Executive David Crowley to hear his plans to improve the health of the community despite budget challenges. But first, we visit Froedtert and the Medical College of Wisconsin and learn how they're addressing racial inequity by examining the healthcare system structurally and making sure that the highest level of care is accessible to every member of the community. Stay with us. Welcome back. There's a saying that if you have your health, you have everything. But sometimes, even with insurance, accessing the right care and understanding what care you need can be a challenge. Fortunately, it's a challenge Froedtert and the Medical College of Wisconsin is meeting head on. Nothing is more important than your health, and the folks here at Froedtert and the Medical College of Wisconsin are doing everything they can to make sure people have access to quality health care, no matter where you live or whatever pre-existing medical conditions you might have. Having coordinated care is key to living a life that is long, happy, and healthy. Joining me now to talk more about this is Dr. Mark Lotus. He is the Vice President and Chief Medical Officer, Population Health and Medical Education here at Froedtert and the Medical College of Wisconsin. Thank you for having us here today.
Great to be here with you.
What does health equity mean to you?
Well, at its most fundamental, and as a physician, I'm boarded in internal medicine and pediatrics, it really means giving the best possible care and getting the best possible outcomes for each of my patients. From a population health standpoint, it really means doing that for all of our communities and for all of our patients that are in the broader community and seek care with us. So this really aligns closely to our mission and to our commitment to enhancing health equity and to eradicating racism. That racism piece we think is a really important part of the mission and seeing health disparities improve. We break that down really into structural racism and then our people and how we enhance our people to really interact with every person with dignity and respect. I often get this quizzical look when I say structural racism. People say, they kind of lean in a little bit and ask, well, what do you mean by that? And so I'll give you a hypothetical here. Imagine a community in which there's 30 breast cancer screening locations in a given community. I'm not talking about Milwaukee here, a hypothetical community. And those 30 centers are open from 8 to 5, Monday through Friday, and available to the whole of the community. But now imagine I tell you that only 5 of them are accessible by public transportation. And now imagine I say of those 5, 4 of the 5 have technology that's older, that doesn't have the state-of-the-art digital mammography or 3D mammography available. All of a sudden, we've introduced a structural component in which folks who have privilege of having a car and having transportation can get to any of the centers, who may have a job that allows them to take time off work with paid time. But those individuals that are reliant on the public transportation, on the subway or the bus, or who can't take that time off work, may not have access to the services in the same way. And even if they do access them, may not have the same level of technology available to them if they need that added technology for their exam. So we've introduced the structural piece. So we're committed at Froedtert Medical College to overcoming those structural issues that are present. And then at the same time, for our people perspective, to having dignity and respect for every one of our patients that comes through the door, to really promoting us looking at our biases, understanding what all of our personal biases are and how we mitigate those, to making sure our policies and procedures follow all that. And that at the end of the day, what it feels like is that you can access us and get great care with us regardless of your background, your race, your ethnicity, your gender identity. You know, everyone in the community has that access.
So for patients then, when it comes to their everyday care, that means not just knowing that quality healthcare exists, but really being able to literally access that. Clinics that are closer, more hours that may be open.
That's exactly right. And we're working together to really identify what those steps are that we can take to improve that access. Some of it's geographic. Some of it may be transportation related, right? Some of it may be education related. I don't know that I'm supposed to have this screening done. And now that I know and I'm educated, I understand why I'm willing to come and do that. Some of it's economic, right? We know that social determinants of health are a big factor in these barriers. And we also understand that many of the social determinants of health are the primary drivers of health outcomes. So what I do, we'd like to think in healthcare that everything we do in kind of delivering mammographies and colon cancer screening and treatments, that this represents like the majority of health outcomes, like how healthy you are or communities are. But in reality, that's only 20%. It's only 20% of health outcomes. So our health outcomes are tied to healthcare delivery. The rest of it is all the other things that involve health, like whether you're a smoker or not, whether or not you maintain a healthy weight, whether you have access to healthy foodstuffs, fresh fruits and vegetables, and all of those types of things, whether your environment is clean. We know that many of our patients live in communities that have water, air quality issues, all the rest. And it's much different in affluent communities compared to communities of lower socioeconomic status. So all of these other things play a role. So we view kind of our role in healthcare in delivering that healthcare product, but in also being a force toward that broader community goal of trying to create safer, healthier communities.
Those are really, in some cases, very large barriers that healthcare can't always control. So how do you work then with patients, with communities, to address those issues that are not always within our control, and that we can, even though we know that being able to control them or at least influence them makes a difference in how healthy people are?
Yeah, it's a great question. Well, as an academic health system, we're really committed to education as one of our missions. So I think first and foremost is educating communities on the issues surrounding health equity. If there's not that knowledge, then it's hard to be an advocate for that change. So that education piece is a big part, both to our patients directly as well as to the community. I think from there, then it becomes how can we together, Froedtert Medical College is one of the allies to the work, really promote the development of healthy communities, of economic revitalization. Some ways that we can do that, we're more than just the deliverer of healthcare too. We buy services from lots of different companies throughout the region, right? We buy supplies for all of it to deliver healthcare. And so having that supplier diversity is a big part of what we do too. And I'm really proud of what the organization's done over the last 20 years in really making sure that we're buying as much as we can from diverse suppliers, right? So that elevates that base of economic, equality, and contributes to that within the community. The other places we're a big employer too. And those that aren't in healthcare, it may come as a surprise, but I don't think it will come as much of a surprise that we're in a crisis of finding enough people to deliver healthcare. And it's not just those that are trained in providing care in our teams. It's also folks who support this whole infrastructure, from our environmental services and food services to our to our support services administratively. And so really working with the community to train individuals to come into a really life-sustaining wage and benefits with our health system and to choose a career in healthcare, real opportunity for us too. And it's another way that we view our ability to enhance equity within the community.
So this push towards equity in healthcare is about so much more than, even though that is important, where clinics are located. It really is looking at what the community's needs are in a very holistic way and working to address those, even in ways, as you've just described, that some people don't think of as being healthcare related.
That's right. That's right. And as a very big employer, more than just with Froedtert Health side alone, more than 10,000 employees, we very much view that employment piece and that cultivation of healthcare careers as core to the work that we do. As we look at addressing some of those structural barriers and access to care, I can give you a few examples of some things we're doing. So we've been working on, and we've been focusing on, we said, boy, if we can't focus on our own population that calls us their medical home, that comes and gets their primary care and most of their specialty care service with us, if we can't get it right from a health equity standpoint for that group, it's going to be hard for us to get it right for the whole of the community, for individuals that may or may not have a relationship with us. So we have a gap of somewhere between 6 and 10% between our white population and our BIPOC. We've created a BIPOC A population, which is Black, Indigenous people, people of color, and our Asian population. We have a big Hmong community, Filipino community. So we've looked at that group and looked at the rates of things like breast cancer screening, colorectal cancer screening, and pneumonia vaccine. And we have somewhere between a 6 to 10% gap, with our white population having a better profile or better gap closure, better compliance with those measures than our BIPOC A population. And then we asked statistically, why is that? What are the factors that are underlying that? We did a pretty complete analysis and saw a whole variety of factors: social determinants of health, economics, insurance, whole variety of factors that were affecting that. And then we've tried to put into place solutions that are going to address that. We talked to our patients and asked them, how do these solutions sound, and how can we co-design this with you and the community?
And it seems like the more success you have in that, two things can happen. One, you take a look at other opportunities that you might be able to create. And secondly, you engage more partners. So you have more people who are really working with you very closely on the issue of healthcare equity.
You do. And sometimes we think of this health equity as kind of the yin or the yang. It's one or the other. It's a Boolean thing that basically you're not getting the services or you are, and we're focusing on the people who aren't getting the services. But it's actually a little more complex than that, because some people are accessing the services, but they're doing it with extraordinary effort. They have barriers that they are spending time, effort, toil to try to get that done in an extraordinary way, and they're accomplishing it despite the fact that we haven't had the kind of convenience or the kind of equity that we want to have within the services. So not only are we bringing more people into those screenings, we're making it easier on a lot of folks that are having a really hard time struggling to get the services today.
You all are doing some really great things to do that kind of outreach. But as individuals, we have some responsibilities for our own health care. What are some of the recommendations that you would make for us as individuals to make sure that we're maximizing the efforts that we're making and the opportunities that exist to make sure we stay healthy?
Yeah, absolutely. So the first thing I'd stress is having a primary care physician. And as a primary care physician, maybe that is a little self-serving, but I will say that having that quarterback, it's hard to have a football offense without a quarterback. Someone to kind of help you to navigate through those challenges and to identify those things that are recommended for you at your given stage in life or age in life or conditions that you have. So having that quarterback's important. The second is to understand those standard screening items and standard immunizations and things that generally everyone needs, that we need on a population basis to keep us healthy. And understand when those are necessary, that you're availing yourself of those. We're coming up on a flu season here. We haven't seen flu the way that we've seen flu in the past because of the pandemic. We also have a lot of young people and children that have never really been exposed to the flu before as a result of that, young children that grew up in the pandemic. And so we think the environment is just, and the milieu's right now, that there might be a little bit of a wallop here with this upcoming flu season. So everyone get out there, get that flu shot. it's going to be an important thing as we get in this season. Hopefully we can mitigate that too, even in the throes of the ongoing COVID pandemic that we're seeing.
Well, good advice. Thank you so much. We really appreciate you being here with us and having us here at Froedtert. Dr. Mark Lotus is the Vice President and Medical Director or Chief Medical Officer for Population Health and Medical Education here at Froedtert and the Medical College of Wisconsin. Thanks so much. Great advice.
Thank you so much. It was my pleasure.
Small businesses create more than half of all new jobs in the United States. When we return, we'll learn about how U.S. Bank is helping small businesses, especially those owned by women and people of color, to navigate unique challenges in order to thrive. Welcome back. Small businesses face challenges and struggles that mid-size and large businesses sometimes don't. Access to funding and resources is key for small businesses to get off the ground, to thrive, and to survive. We were able to visit a thriving small Black-owned business and sit down with U.S. Bank to learn more about how they're simplifying the experience of starting and running a small business here in Milwaukee. Small businesses play a big role in business in the United States, creating more than half of all new jobs. Small businesses run by women and people of color sometimes face unique challenges to their success. Fortunately, U.S. Bank has a team that's dedicated to helping small businesses reach their fullest potential. Here to help us learn more are Nita Johnson, Senior Vice President, Wisconsin Branch Banking Market Leader, and Sheldon McClure, Senior Vice President, Wisconsin Business Banking Market. Thanks to both of you for being here with us and for letting us learn more about what U.S. Bank is doing to help all businesses be successful. Help us understand first, how are the needs of small businesses different from the needs of larger companies?
They have a lot of similarities, but the things that are different, I think about small businesses, they're just trying to get started out. They have a passion. They have a passion for something that they just want to continue to do. But as all of us know, when you get into business, there's more than just that passion. You have to have funding. You have to have people. You have to have marketing. There's a lot of different things. So small businesses typically struggle up front if they don't have these resources or even information up front, where I would say larger and mid-sized businesses typically have a handle or even someone running that. So I would say that's probably the primary difference between the two and where the struggles are at the beginning that most small businesses have to overcome.
It's really important then for small businesses to make sure that as they're going through the process of getting established, putting together their business plans, that they find a financial institution that really understands and is able to work with their unique needs.
I think if you can find an advisor at any bank institution that, whether they're certified or they have a proven track history of helping owners find resources. Resources are the name to the game. A lot of small business owners are able to navigate a lot simpler and easier. We're going to find bumps in the roads, but you are absolutely right when it comes to a financial institution, being a guide and being a resource, and U.S. Bank has those things, and that's what we want to make sure people understand and know.
When it comes to businesses run by women and people of color, historically, there have been some unique challenges that those businesses face. Tell us a little bit about what you've seen in your experience in terms of those unique challenges.
This is so important to what's happening. You said early on that more than 50% of people are moving into entrepreneurship. And when we think about what Sheldon just shared, that there has to be this network that's built out to help the small business owner move forward in their career, it goes beyond the purpose of, passion to, okay, the resources needed to be successful. And so in answer to your question, when we talk about women as well as populations that may not necessarily have access, one of the things that U.S. Bank is very serious about, we actually took the time to invest in 30,000 women nationwide and people of color over the last couple of years, because we know that it's really important to provide the support whenever there may be limits to what access looks like for the business owner. Certain things like knowing who your accountant should be, understanding the importance of operations management, realizing that even though you create something, you still have to have a business plan associated with it. You mentioned that before. We work closely with community development financial institutions, commonly known as CDFIs, and those institutions, along with what we do internally, help us to build a bridge for the entrepreneur. So, perfect example of a CDFI just happens to be one of the organizations that help build out what we're in right now, which is the Wisconsin Women's Business Initiative Corporation. But you've got LISC, Local Initiative Support Corporation, and other organizations that U.S. Bank partners with, and we provide dollars, grants, sponsorships, et cetera, to continue to help build that bridge for the new entrepreneur.
We are here at Diamond Disc International, which is one of the companies that's in this facility. Beautiful facility, great company. But you all have partnered with the owner throughout the process of building his business. What are some of the things that you've done, perhaps some of the unique services that you've offered to help him get to this point and to position him for even more growth?
I'll let my partner start off and then I'll finish off.
Okay, this is a long story that comes full circle because, you know, this is such an amazing leader. Ugo is just a staple in the Wisconsin footprint, and just knowing that U.S. Bank had an opportunity to have some type of imprint on what success looks like for this leader has just been an honor to be a part of the journey for him. But it goes back to WIBIC. When I mentioned WIBIC, I literally was volunteering on WIBIC's loan committee and supported one of the loans that helped to move him from being an employee to an employer. And so just from that perspective to today, where Ugo's one of our most prominent customers and colleagues out in community, inviting U.S. Bank to be a part of the network that he's built out, it's just, you know, full circle by all accounts. I think that's the best way to describe it. And so just walking into the facility today and seeing the apple tree out front and just, walking through the warehouse, it's just amazing how vision is happening right here in Wisconsin. And now everyone gets a chance to experience what was originally just a thought.
So Diamond Disc International, so we're a leading distributor and a wholesaler to the infrastructure industry. And we specialize in the diamond edge cutting tools. And as we've grown over the years, building relationships with some of the industries, the nation's leading infrastructure contractors, the questions become, what else? And so we've grown into other areas, handheld power tools, safety equipment. So now we really is a one-stop shop, especially for your utility contractors, road construction firms, but a lot of your infrastructure firms are seeing how we provide more value to our existing relationships all across the country. And we've been able to get our foot in the door and build these relationships. It's how do we continue to expand within those relationships and provide more value, find out the best quality tool, how do we make the best quality tool, and then we invest. It was really rewarding for me as a business owner. It was really rewarding for me as a native Milwaukeean, born and raised, to get to a point where now I'm helping out our community. I always say as an entrepreneur, don't say small business because you don't look at yourself as a small business, and look at the vision that you have. Some of the challenges are the same, whether as for other small businesses or even some of the challenges as far as other large businesses, but the difference is the obstacles that you have to go through. The difference is the access to not only the opportunities, but the resources. And I fight the challenges on both sides, and that's, I think, where the major difference comes. And so with U.S. Bank, they've really done an amazing job of removing, like you mentioned, removing some of those hurdles, those obstacles that unfortunately exist when diverse businesses look for access to those financial resources, because you have to have it.
Have to.
Especially when you're looking to grow, especially when you're looking to achieve your vision.
Oh, yeah.
And the things that we're trying to create, the things I'm trying to create is generational change. How do we impact this ecosystem that not just our business, but we're creating employment opportunities. It was very intentional for me when I moved here to this location that we had the resources to create employment opportunities in the city of Milwaukee. And again, invest in a way where this is something that's impacting our daughters, that next generation? You know, how do you have generational investment that really impacts the topography of this land,
Yeah.
and other people really see, hey, this is what a diverse business looks like, as far as not just being, again, we're not just local, we're a national supplier. We're nationally recognized supplier of the impact that we have across the country. And as you're changing that ecosystem, you're changing the topography, now we're creating more fertile soil for other diverse businesses.
Are there other services or opportunities that small businesses can find when they're working with U.S. Bank?
So there's different programs that we provide. We just launched a new kind of a one-stop shop for payments, for example, where somebody who's just getting started, they really don't have a business owner yet, but they have payments, merchant services that are necessary to help their business move forward. We have a new solution that it makes it very simple. And within the bank overall, what we've tried to do over the course of the pandemic is try to simplify the experience of financial education, financial access, just because, you know, we don't know what the world will be like post-pandemic. We're still on the tail end of it. So from that perspective, we're continuing to evolve and pivot as necessary, to pull technology in as needed to make the small business owner a little bit more free to do the coaching if necessary versus focusing on a spreadsheet. So from that perspective, we do have some new merchant services solutions for our customers. It's in alignment with our Bank Smartly or smart banking solution, which we have launched on our retail side of banking, and it's full scope. So not only are people trying to bank smartly, but they're also trying to support their businesses in a new and unique fashion.
How do you know when you are successful in terms of being able to meet the needs of your small business partners? Or is that kind of an ongoing process?
We are pivoting all the time. And in fact, one of the things that we just did, which continues to move forward in business lines throughout the bank, is adding a level of talent that looks like the community that we serve. For example, our mortgage team just added appraisers who are people of color because there aren't any in certain states. Wisconsin's one. So from that perspective, we're trying to make sure that we have a coachable opportunity to train our minority talent so that they can become people in banking, per se, that can help to support areas of color. Right now, you know, that's one of the things that we're doing on the appraisal side, MLO side, mortgage loan originator side, business. I mean, we're just continuing to evolve as it pertains to making sure that talent internally looks like the external talent that we support.
When we return, we'll visit an after-school program that helps connect students to their heritage, history, and culture through music. Welcome back. It's been long proven that music education improves overall learning in countless ways, from developing language and reasoning to simply building self-confidence. Students from St. Anthony's School in Milwaukee have been participating in an after-school drumming group that enriches their everyday learning while connecting to their history, culture, and each other.
But gotta pay attention to the break now.
This is an after-school African drumming group, Afro-Cuban drumming group. And what we do is we bring the kids, it's voluntary, and they come in after school and learn Afro-Cuban beats on drums. I think the main thing that kids get out of music itself is the discipline of getting from point A to point B, and the discipline of perfecting something, and also working as a team and representing their school in a great way. And what better way to represent their school than through music and drumming, you know.
We do teach the kids in terms of the history of drumming. What I mean by the history of drumming, meaning the history of drumming pretty much here in the United States. And because as you know, United States is a melting pot. There are different people coming from different races, different places around the world. So if you look at it in that standpoint, you cannot say like this music freely from Africa or this one and so forth, because if something like we all speak, something that we all feel, so that means it belongs to everybody, it belongs to all of us. But to a certain extent, it's good for the kids at least to know history. So what we've been doing in this program is teaching the kids the origin of the music here. Of course, coming mainly from Africa and brought over here or around places around the United States by the African slaves. So that's what we've been doing, and we've been talking about. We built it up from rumba, which is like one of the main beats, like well known all around the Cuban area, Puerto Rico, Cuba, and places like that. And nowadays it's very popular around the world, and that came from Africa.
We learned African culture. They have history, like important things we need to learn now.
Educating a child holistically is great. So instead of just educating or developing one side of the brain, we want to also develop the creative side of the brain as well. And African drums is one of the best ways to do it. Working with rhythms, working with an ensemble, working as a team in order to make beautiful music together is an awesome way to do it. I don't really look at it as extracurricular. Music is a curricular event for us. We just happen to do it after school.
I just like learning about like new beats and stuff and friends. No, I just like taking drumming and just doing music and stuff.
Kids get excited about coming in and being able to make music and play rhythms together and play drumming, do drumming together. And we have pretty much 100% attendance. So once you get it together and everything sounds really good, kids get excited about it. So being excited about being at school is a good thing.
I take this class because it makes me learn more stuff, and I get to learn about the African drums, and I get to meet new friends, new people, and stuff like that.
When you start a project like this, when you see the outcome, when you see the impact that project has, but it does to the kids. And of course, overcoming one challenge, which is like not knowing how to play one beat and get to one point where not only you know how to play the beat, but you master it, You see that smile, you see that, all of that. So you're teaching them like a teamwork spirit. So they learn how to interact among themselves, in a positive way. That's another thing. Leadership skills involved too, because you get to one point where you get them to learn how to lead the group. A lot of these kids, they come from different backgrounds, so stressed out and all kind of stuff. But music helps relieve all that stress, all that anger, all that frustration. You see what I mean? Helps you definitely become a positive person instead of a negative person. Because once you get your drum, you play music and stuff like that, through the drums, you get rid of all those negativity, dealing with frustration, again, anger, and all kind of stuff you go through in life.
When we return, we'll visit with Milwaukee County Executive David Crowley to learn more about his philosophy that a healthy community begins with equal access to services for all. Stay with us. Welcome back. We began this episode discussing the need for equal access as it pertains to the healthcare industry. In our closing conversation tonight, I was able to sit down with County Executive David Crowley to hear his vision for making Milwaukee County the healthiest county in Wisconsin through awareness of and access to services, crime prevention, criminal reform, and the intangible value of our county park system. Well, we're in 2022, but we are already thinking about the 2023 budget. When you presented your budget, one of the things you talked about was that Milwaukee County is going to have to for the foreseeable future, do more with less because of a structural budget gap. Yes. What is that structural budget gap, and what does it mean?
Well, this year is about $12 million. And so a structural budget gap is basically saying that we're receiving so much revenues, which is pretty much capped, but we're not getting enough revenue to actually keep up with the cost of all the services. And so when you think about inflation, when you think about the rise in wages and things of that nature, we have to have revenues coming in, whether that's through a sales tax, whether it's through property taxes, or other means like different types of fees. But because we have a state cap that says that we can't raise property taxes over so much, that makes it much harder for us to actually fund many of the programs and services that mean so much to people. And a lot of that is because we are also an extension of the state of Wisconsin. So the state can actually mandate us to actually cover certain types of costs. And that could be related to the court system, jails, House of Corrections, or juvenile justice, just to name a few. And because of those inflationary costs, we will not have any dollars to invest in like our Milwaukee County Parks programs or Milwaukee County Transit System or in mental health services or even in our homeless outreach. And so our structural gap really hampers our ability to really make investments in our community, as well as investments in our vision of being the healthiest county in the state of Wisconsin.
Now, obviously, there were some cuts that you did have to make because of those the structural budget gap. But you also have used the budget to kind of reshape and reinvest in some areas. And one of those areas is an area that traditionally has seen cuts, Milwaukee County Parks, which people really know and see as a treasure in our community. What's your vision in terms of what you're going to be able to do now in Milwaukee County Parks because of this increase in the budget for?
Oh, absolutely. When you think about our county parks, I mean, for the past 30 years, they've seen a lot of reductions. And this is a good thing for us related to this budget, not seeing the major cuts to different types of services. And so we will see some major some service reductions in some of our programs. But when you think about our parks, I truly believe that they are the beating heart of communities, right? This is a place where families, no matter your income background, no matter where you live, because we have 157 parks all across Milwaukee County, where people can get not just that mental refuge, but also get some physical activity and where families can come together. And so when I think about our park system, you know, we still have a huge capital backlog. But so investing this $1.5 million into the park system is going to help us make sure that we can continue to have a safe space for many of our families, but we want to continue to do more. And so this is going to give us the ability to really reach out to many different communities all across the county and let them know that our park system is there for them. So no matter, you know, what season it is, no matter what time of the day it is, just not after 10 o'clock p.m., that we want them to really enjoy our Milwaukee County Park system. And so for us, this is an investment not just in racial equity, but in health equity, because we know that the disparities in health lies along the lines of race. And when we look at the health disparities here within the state of Wisconsin, you know, we're one of the least healthiest counties in the state. And so for us, this is how we're able to give back to the community and really reinvest in our mission and vision again.
And you talked about making Milwaukee County the healthiest county in the state. How does the vision of the parks piece really work to move that forward?
So one of the things we talk about is how do you invest upstream, right? So when we think about, what we're seeing in the community, a lot of the times we are treating symptoms, right? But we need to really focus on the root causes. What is getting people to have police contact? Why are people homeless? What do we need to do to really invest upstream? So when we think about our parks, just in general, you know, mental health wise, this is a place where you can go and just relax. You ever go to one of those parks? You know, everyone has their favorite park. My favorite park is Nash Park, which is not too far from my home. And, you know, whether I'm walking my dog or my dog Cosmo or taking my kids to Nash Park to play on the swing set, it's a place where I can just sit down, relax, you know, look at the beautiful trees, look at the changing of the leaves, you know, during the fall. But more importantly, just really just take a mental break and just think about, you know, my present being. And so when we think about parks, that's one way of doing it. But When you think about parks, right, it's not just those parks. We have thousands of miles of trails. We have golf courses. So we have the ability to invest in our physical activity as a community. And we want people to utilize that, whether they're walking or riding their bike on those trails. And so when you think about that physical aspect, when you think about particularly, we talk about health disparities, particularly in the Black community and so many people who may have like a chronic health disease. When you go into a park, there's ways that we can mitigate a lot of these issues that we see in our communities. And we want people to look at our parks, not just a space to go play, but a space where you can get that physical well-being that you need. So for us, this is a tremendous investment back into the community. But also we know that we have to tell our story about what the parks are here for, what do they do for people, and really encourage people to really activate them, because the more we activate our parks, the safer our parks are as well.
You're also making a really significant investment when we talk about making Milwaukee County the healthiest county in the state. You're making a significant investment in both mental health and in physical health, $21 million for the community access to recovery services. How will that money be spent, and what do you anticipate we'll begin to see as some of the outcomes of that investment?
Well, when I think about the outcomes, I'm hoping that we start to see a reduction in many of the calls that we have seen in this past pandemic, right? We have seen mental health crisis calls uptick. We've seen an uptick in suicide calls. We've seen an uptick just in all the negative things because of the onset of this pandemic. And so when you think about this particular investment, this is about how do we give people critical access to the services and programs that we need. And we know that that's one of the biggest barriers for people having access, is even knowing that those programs are even out there. And, earlier this year, we started a health and healing series where, I grew up in a home that suffered from both mental illness as well as drug addiction, and wanted to talk about my story because we have to normalize these conversations, really breaking down the stigma. And so for us, how do we continue to make those investments, making sure that people know where the services are, and not coming to us to figure it out, but going directly to their doorstep, going to their community to make sure that, we're going to give you access. We're going to tell you what the resources are, because if you have to come find them, you may not be able to, because you may not have access to the internet or the resources needed to access that information. And so for us, this is about how do you get access not only to the mental health services that you need, but the recovery services that so many folks desperately need. Because when you think about last year, we broke a record in the amount of opioid deaths that we've seen, and we want to get ahead of that. And so this $21 million investment is going to help with that. But there's so much more that we need to continue to do in this community. But that's going to take all of us stepping up and making sure that we have the resources to make those investments.
So when we look at these investments, you really see them as being community-based, making sure that what folks need to access is where they are.
Mm-hmm. Absolutely. Growing up, I faced evictions, and my mother, when we were going through an eviction, it wasn't because she didn't want to pay her rent. It's because she wasn't getting enough hours, being a bartender or being a wait staff, right? And so, she had to figure out, how do I find these services? How do I make sure that we have a roof over our head? But not just that, right? Because, how do I make sure I can put food on the table? And if we get a roof over our head, how do we make sure we can pay for the utilities? You have to know where those resources are. And so, coming from where I come from, growing up on 23rd and Burleigh in the 53206 zip code, and moving to 22nd and Brown, and then the 24th and Lloyd, and the 29th and Walnut, and the list goes on and on because of the housing insecurity that we lived under. It was about how do we get access to those resources. And I got involved in politics because, I started doing community work, and I truly, blame this community for creating me who I am today. And so this is a way to really give back. And when you think about government, we are in partnership with the community, and we can't do this alone. And when you think about the times that we're living in right now, not everyone really trusts government to do the right thing. So for us, it's about how do we bring more people to the table, build a bigger table so we can continue to collaborate, but more importantly, coordinate the services that everyone absolutely needs.
One of the things you're also looking at in the budget is the House of Corrections, and really kind of working to provide people when they're in the House of Corrections some of the support that they need, so they can successfully complete their time there, but then also and recidivism, or at least help to reduce that. Tell us a little bit about those efforts.
Well, again, growing up in the 53206 zip code, this is one of the most incarcerated zip codes in the country. I would possibly say the world, because I don't think they use zip codes anywhere else, outside of the United States. But we can't continue to have a revolving door when it comes down to our criminal justice system. And so we want to make sure that people are not coming back to the House of Corrections, which is going to be now the Community Reintegration Center, which we're really excited about. We really want to give people the resources that they need, so they don't have to, go and make a decision that's going to land them in the House of Correction or a state prison, because they're trying to put food on the table, right? Trying to make sure they have a roof over their head. So if we want to make sure that people are living their best lives, not just for themselves, but for their families and for this community, we have to give them the tools, we have to give them the resources that they need to be productive citizens. And so we're going to focus on how can we, train them, how can we upskill them in many different capacities, in many different industries, to make sure that once they leave our four walls, that they're actually going back and finding employment, finding housing, finding health care, so they can become productive citizens. And that's critical. That's critical in this time frame, if you ask me, because, this is how we invest back into people. When people make mistakes, they make a mistake. And in order to make sure that they don't make another mistake, we have to make sure that they have everything that they need. And sometimes that's not just the resources, but that could be the support that they need from other people who've been in similar situations. And so that's one of the reasons why we invest in like the Credible Messengers program, people who've been involved in the justice system in some capacity, but can be mentors to young people before they enter our system and really support their families in helping out with that young person. And these are things that we have to continue to do, because again, the more we can invest in our people, the more we can see a upward trajectory in making sure that this is the best community we can live in.
10 years from now, what does Milwaukee County look like?
Oh, wow. Our vision is that by achieving racial equity, we'll be the healthiest county in the state of Wisconsin. And, it's really about I want to see racial equity all throughout Milwaukee County. And what that looks like is having diverse communities, not just within the city, but across all 19 municipalities, having a transit system that gets people to and from work, not just within the county, but working with other municipalities outside the county to make sure that people have access to those family sustaining wages. I think about mental health, having a robust mental health system, behavioral health system that gives everybody the access and the services that they need. And not just when there's a crisis, but when they know that, something seems off and I need a little bit of help, and we can talk about the mental wellness of everybody. Seeing a reduction in the violence and the crime and the reckless driving that we're seeing, because we're finding things to keep our young people not only motivated, but occupied. Because, like my grandmother used to say, idle mind is the devil's playground. And so we want to find things for everyone within Milwaukee County. But the real idea is that no matter where you come from across this country or across this world, we want folks to know that Milwaukee County we have a place for you. No matter your ethnic background, no matter who you love, no matter your gender, we are here to support you in every capacity that you need. And it's really about investing in the quality of living of individuals so we can be the best place in the Midwest. I tell everybody you can leave the East Coast, you can leave the West Coast, you can leave the Gulf Coast, and come on up to Milwaukee where we have the Fresh Coast.
County Executive Crowley, thank you so much for sharing your vision with us and for spending some time with us today.
Thank you so much. Always a pleasure.
Thank you for joining us on Connect MKE, Conversations on Race. To rewatch and share these important stories, visit our YouTube page at youtube.com/connectmke. And as always, join us weekly for our discussions with local leaders and community members on Connect MKE each Saturday morning on My 24 and Sunday mornings on CW18. I'm your host, Denise Calloway. Thank you for joining me tonight on Connect MKE, Conversations on Race. Special thanks to our sponsors, Froedtert and the Medical College of Wisconsin, AERP Wisconsin, U.S. Bank, and the Milwaukee County Office of Equity.